Have you ever come home after a nice walk through the woods or an afternoon in the garden, brushed off a bit of dirt, and thought nothing of it? Maybe you noticed a small bug bite on your leg or your arm and just figured it was a mosquito. No big deal, right? But what if that tiny bite came with consequences far bigger than you imagined? It's easy to overlook something small, especially when life already feels full, with work, family, routines, errands. And let's face it, who really pauses to worry about ticks? They're tiny. They're sneaky. And most of the time, you don't even feel them bite. But here's where it gets serious. One small tick bite can lead to Lyme disease, and this infection doesn't always show up with a fever or a rash. In fact, many people don't even know they have it until weeks, months, or even years later, when something just doesn't feel right. So why are we talking about Lyme disease today? Because it's not just a disease that affects hikers or campers. It's showing up in suburban neighborhoods, backyards, parks, and even people who rarely leave the city. And the consequences can be far-reaching, from fatigue and brain fog to joint pain and heart issues. That's why in this video, we're digging into how a single tick bite can change everything, and more importantly, what you can do to protect yourself and your loved ones. Let's start by getting real about what Lyme disease actually is. It's caused by bacteria that are passed on to humans through the bite of an infected black-legged tick, also known as a deer tick. These ticks are about the size of a poppy seed, so small you could miss one entirely unless you're looking very closely. And once they bite, they don't just nibble and move on. They attach and feed slowly, sometimes for 36 to 48 hours. That's how they pass the bacteria into your body. Now, in some cases, Lyme disease starts with a telltale sign, a bullseye rash. That's the textbook symptom. But here's the catch, not everyone gets that rash. In fact, a large number of people never see it at all. So they think they're fine. Until they're not. Maybe a few weeks go by, and suddenly they feel unusually tired. Like bone-deep exhaustion. Or they start waking up with stiff joints, foggy thinking, or random heart palpitations that seem to come out of nowhere. Here's where it gets tricky. These symptoms can look like a lot of other things. Stress, aging, a bad mattress, low iron, even anxiety. Doctors might run tests, and those tests might come back normal. You might be told it's just in your head, or that you're just getting older. And while it's true that our bodies do change with time, Lyme disease has a very different fingerprint. It creeps in slowly. It mimics other conditions. And if left untreated, it can become chronic, affecting your quality of life for years. Let me tell you a quick story. A woman named Lisa, in her early 40s, was super active. She gardened, hiked with her kids, worked full-time. One summer, she noticed she was getting tired more often, and her knees hurt more than usual. She chalked it up to getting older. But then came the headaches, the memory lapses, the strange buzzing in her legs. Doctor after doctor ran tests, all of them inconclusive. No one thought to test her for Lyme. And by the time someone did, the bacteria had already spread to her nervous system. Treatment helped, but it took years of work to start feeling like herself again. That's the thing about Lyme disease. It doesn't care how old you are, how healthy you are, or where you live. It just takes one bite. And if you don't catch it early, the ripple effect can touch every part of your life. Now, that sounds scary. But fear isn't the point here. Awareness is. Because when you understand the risks, when you know what to look for and how to act quickly, you take back control. One of the most important things you can do, whether you're out hiking, gardening, or just spending time in nature, is a simple habit. Check your body for ticks every single time you come inside. Look behind your knees, around your waistband, in your scalp, under your arms, all the warm, hidden places ticks love. It only takes a minute or two, but that quick check can be the difference between catching a tick early or dealing with the consequences weeks later. And let's not forget about clothing. It might sound old-fashioned, but wearing long sleeves, tucking pants into socks, or using tick repellent sprays with DEET or permethrin can offer a surprising amount of protection. especially if you're walking through tall grass or wooded areas. Here's another thing most people don't realize: your pets can bring ticks into your home. Dogs especially love to roll around in the grass, and those tiny ticks can easily hitch a ride on their fur and end up on your couch, your bed, or your skin. So if you have a pet, it's just as important to check them regularly and use vet-approved tick prevention. But let's come back to you, because the reason you're here, watching this video, probably isn't just curiosity. Maybe you've been feeling off lately. Maybe you've been dismissed by doctors, or you're tired of being tired. Or maybe you just want to protect yourself and your family from something that seems invisible but has real, lasting effects. You're doing the right thing. Information is powerful. It's what helps us connect the dots, ask better questions, and take action when it matters most. Now that we've looked at how Lyme disease gets into the body and why it can be so hard to spot, let's move forward and explore what actually happens once the infection starts spreading. Once Lyme disease enters the body, it doesn't just stay in one place. This isn't like a cold that stays in your nose and throat. Lyme bacteria are sneaky. They move through your blood, your tissues, even into your brain. That's why symptoms can pop up all over the body, sometimes far from where the original bite was. It's one of the biggest reasons this illness is so hard to diagnose. It doesn't follow a neat, predictable pattern. Some people feel flu-like symptoms in the beginning. A fever, chills, maybe muscle aches. Others might skip that phase completely and jump straight into strange joint pain, or weird shooting sensations in the arms or legs. Then there's the mental part, and this is where things can feel really scary. People report forgetfulness, trouble focusing, mood swings, and even anxiety or depression that seem to come out of nowhere. Imagine waking up and suddenly struggling to find the right words, or forgetting what you were about to do 2 minutes ago. It can feel like your brain just isn't cooperating anymore. And if you've ever felt something like that, let me tell you, you are not imagining it. Lyme disease can absolutely affect the brain. There's even a term for it: neuroborreliosis. Sounds technical, I know, but what it means is that the bacteria are interfering with how your brain and nerves work. That's why people with Lyme sometimes describe feeling like a fog has settled over them. Not tired, not sleepy, just foggy. Like their thinking is slow or unclear. One of the hardest parts of this illness is how isolating it can be. You don't look sick. Maybe your tests keep coming back normal. So you start doubting yourself. People around you don't always get it. They say things like you're just stressed, or maybe you're just not sleeping well. And the worst part? You might start believing them. That's why it's so important to trust your gut. If something feels off, don't brush it aside. Keep asking questions. Keep pushing for answers. Because the truth is, early treatment matters. The sooner you catch Lyme disease, the easier it is to treat, often with just a few weeks of antibiotics. But if it goes undiagnosed, it can turn into a chronic condition that lingers for years. That's not said to scare you, it's said to empower you. You have the power to act early, to notice your body, to speak up when something doesn't feel right. So let's talk about what happens if Lyme disease does go untreated for a while. This is where we start seeing what's called late-stage Lyme, and the effects can be pretty serious. We're talking chronic joint inflammation, especially in the knees. Numbness or tingling in the hands and feet. Irregular heart rhythms. Some people even experience facial palsy, where one side of the face droops. It's all because the bacteria have made their way into different systems of the body and are causing inflammation in places they shouldn't. It's a frustrating illness because there's no one-size-fits-all case. One person might just feel tired for months. Another could have nerve pain or brain fog. Some recover quickly. Others take years. That unpredictability can make people feel hopeless. But don't let it. Because there is hope. There are treatments. There are people who understand what you're going through. And most importantly, there are things you can do right now, whether you're dealing with Lyme, recovering from it, or just trying to stay safe. One thing that really helps is building up your immune system. Your body fights infections every day, and Lyme is no exception. So the stronger your immune system is, the better chance you have at healing and bouncing back. That means eating nutrient-rich foods, lots of vegetables, healthy fats, good proteins. It means getting enough sleep, managing stress, and moving your body regularly, even if it's just a gentle walk or stretching. These aren't small things, they're the foundation of your recovery. Hydration is another big one. When you're fighting any infection, your body needs water to flush out toxins. Staying hydrated helps your system work more efficiently. And don't forget about rest, real, deep rest. If you feel like your body's asking you to slow down, listen. That's not weakness. That's wisdom. Another practical step is finding a healthcare provider who understands Lyme. Not every doctor is trained to recognize or treat it, and that's not their fault. It's a tricky disease, and it's often misunderstood. But there are specialists out there, sometimes called Lyme literate doctors, who know what to look for and how to treat it effectively. If you're not getting the answers you need, don't be afraid to seek a second opinion. Your health is worth fighting for. And if you're supporting someone with Lyme disease, whether it's a friend, a partner, or a child, your compassion means more than you know. Just believing them, listening without judgment, and encouraging them through the ups and downs can make all the difference. Chronic illness can feel like a lonely road, but no one should have to walk it alone. Let's come back to where we started, with that one small bite. A tick, barely bigger than a freckle. It sounds like such a minor thing, but the impact it can have is anything but small. That's why awareness matters. That's why taking simple precautions matters. And that's why understanding your symptoms and trusting your body is so important. Lyme disease isn't rare anymore. It's not just something hikers need to worry about. It's everywhere, in parks, in yards, even in cities. And while that might sound overwhelming, there's comfort in knowing that you're not powerless. You can protect yourself. You can recognize the signs. You can seek treatment early. You can heal. So if your body is whispering to you, with fatigue, with pain, with forgetfulness, don't ignore it. Listen. It could be telling you something important. Next, we'll take a deeper look at how Lyme disease is diagnosed, what kinds of tests are available, and what treatment really looks like, not just in a doctor's office, but in daily life, where healing actually happens. When you finally decide to see a doctor about those strange symptoms, the brain fog, the fatigue, the joint aches, the next question that often comes up is, how do we actually test for Lyme disease? And here's where things can get a little tricky. There isn't a single, perfect test that catches every case. That's part of what makes Lyme disease so frustrating for so many people. Most doctors will start with something called an ELISA test, which looks for antibodies your body produces in response to the infection. If that comes back positive, it's often followed by a Western blot test, which is supposed to confirm the result. But here's the catch: those tests aren't always accurate, especially in the early stages. Your body might not have made enough antibodies yet to show up on the test. Or the infection could be hiding in tissues where the immune system doesn't detect it easily. It's a little like trying to catch a thief who's already left the building. That's why a lot of people go undiagnosed for weeks, months, or even years. They get misdiagnosed with things like fibromyalgia, chronic fatigue, depression, or even early dementia. That's not only scary, it's also discouraging. You start to feel like nobody believes you, or like maybe it's all in your head. But I'm here to tell you, it's not. Lyme disease is real. And if your symptoms don't make sense, keep speaking up. Keep asking questions. You know your body better than anyone. The good news is, once it's diagnosed, even if it's late, there are still options. Antibiotics are the first line of defense. For early Lyme, something like doxycycline for a few weeks can often knock it out completely. But for people who've had the infection for longer, treatment might take more time and a little more creativity. Some doctors use longer-term antibiotics or a combination of different medications. Others focus on supporting the immune system and reducing inflammation while helping the body heal from the damage. There's no magic pill, but there is a path forward. It's about treating the bacteria, yes, but it's also about treating you, the whole person. Because Lyme doesn't just affect your joints or your memory. It affects your energy, your mood, your ability to show up fully in life. And that's worth fighting for. Now, let's talk about what healing from Lyme really looks like in daily life. It's not just about medication. It's about creating an environment in your body that helps you recover. That might mean changing how you eat, focusing more on anti-inflammatory foods like leafy greens, berries, wild salmon, and olive oil. It might mean cutting back on sugar or processed foods that feed inflammation and make things worse. It might even mean slowing down your schedule and learning how to rest, really rest, without guilt. Some people find that gentle movement helps. Things like stretching, yoga, or short walks can keep the blood flowing and help reduce joint stiffness. Others focus on calming the nervous system with breathing exercises, meditation, or even warm baths. The truth is, healing isn't about doing one big thing. It's about doing a lot of small, kind things for yourself every day. And just as important as the physical side of healing is the emotional side. Chronic illness can be exhausting, not just physically, but emotionally too. You might feel isolated, frustrated, even angry at your own body. That's normal. But you don't have to carry that alone. Talking to someone, whether it's a therapist, a friend, or an online support group, can make a world of difference. Just having someone say, "I believe you," can be incredibly healing. And if you're someone who's watching this not because you have Lyme disease, but because you want to protect yourself or your family, that's a smart move. Because the best way to deal with Lyme is to not get it in the first place. Prevention matters, and it doesn't have to be complicated. When you're outside, especially in grassy, wooded, or bushy areas, cover up. Wear long sleeves, tuck your pants into your socks, and use insect repellent that contains deep or natural alternatives like oil of lemon eucalyptus. When you come back indoors, do a quick tick check, especially around warm, hidden areas like behind the knees, the armpits, or along the hairline. Ticks like to hide where they're less likely to be noticed. If you do find a tick, don't panic. Use fine-tip tweezers, grasp the tick as close to the skin as possible, and pull it out slowly and steadily. Clean the area with rubbing alcohol or soap and water. You can even save the tick in a Ziploc bag to show your doctor if you're worried. And pay attention to how you feel over the next few days and weeks. If a rash appears, especially that classic bullseye, or you feel off in any way, talk to your doctor right away. It's amazing how something so tiny, a tick the size of a sesame seed, can cause such huge disruption. But it doesn't have to take over your life. Not if you stay informed, stay alert, and stay connected to your body. And here's the most important thing I want you to take from this video: you are not powerless. Whether you're trying to protect your family, recover from an infection, or help someone you love navigate their symptoms, you're already doing one of the most powerful things you can. You're learning. You're listening. You're paying attention. Lyme disease is real. It's serious. But with the right care, the right mindset, and a little bit of persistence, it's something you can fight and something you can come back from. So don't give up. Don't ignore your symptoms. And don't be afraid to speak up for your health. You deserve answers. You deserve support. And you deserve to feel good in your body again. If this video helped you or someone you love, I'd love to hear your thoughts in the comments below. What's your experience been like? What questions do you still have? Let's support each other, because healing is always easier when you're not doing it alone. And if you found this helpful, give it a thumbs up and consider subscribing for more honest, empowering health advice. We've got plenty more videos coming your way, packed with practical tips and real talk to help you feel your best, no matter your age. Here's to knowledge, healing, and feeling like yourself again. Stay safe, stay strong, and as always, take care of you.